Okay, hi everybody. Thanks for joining us today. I am Scott Simon, Regional Director of Communications for WRHA. I'd like to introduce you to the people that will be speaking today. Gina Trinidad, who's our COO, Community Health Services and Long-Term Care Director, and Sandra Gores, who's the Director of Operational Quality for Western Canada and the Regional Director, Manitoba, for Extendicare. They're going to give you an update onto an investigation into abuse allegations at a personal care home here in Winnipeg. Gina and Sandra will speak, and at the end of that, we'll open it up for questions, sort of a virtual scrum. I think as you will be accustomed to, we're asking you to, in the interest of everyone getting a chance, to limit to one question and one follow-up, please. And with that, I will turn it over to Gina Trinidad.
Thanks very much, Scott, and thank you all for joining us today. We are here today to make the public aware of allegations of abuse by two healthcare aides at Extendicare Oakview Place personal care home here in Winnipeg. These allegations of abuse have been reported to the WRHA and are currently under investigation. The alleged incidents involve 15 residents at the facility. We are deeply disturbed and disappointed by these serious allegations and the process the facility initially took to investigate the concerns. The WRHA first learned of these allegations very recently. Our utmost focus is on the health and well-being of residents and communicating with families. This will continue to be our priority. Upon learning of the incidents, we took immediate action. This includes making contact with the Protection for Persons in Care Office and the Winnipeg Police Service to make a report. We can confirm that the Winnipeg Police are in the early stages of a criminal investigation. Additionally, we contacted National Extendicare leadership and together ensured that the healthcare aides in question were immediately placed on leave pending a complete review and investigation. We also shared the report allegations and concerns and are consulting with Manitoba Health's Licensing and Compliance Branch. Leadership in the WRHA long-term care program have also conducted a number of unannounced visits at the facility since learning of these allegations. We have been speaking directly with residents and observing their care experiences. We have also spoken to staff on shift at the time of our visits. The results have generally been positive, and our site reviews have shown the care being delivered is what we expect of service providers. We will
We apologize for that. We'll just give Gina a few minutes to reconnect here. Hi, Gina, you're back.
Yes.
Oh, you cut out for a little bit there.
Oh, okay.
Maybe you could just introduce Sandra and we'll keep going.
Sure. Sandra, I'll turn it over to you now.
Thank you, Gina, for the opportunity to be here today. My name is Sandra Gores, and I'm the Director of Operational Quality for Western Canada and the newly appointed Regional Director for Manitoba, overseeing the Extendicare homes here in the province. I want to start by apologizing directly to the residents and families impacted by these allegations. In February, we were made aware of allegations that residents at Oakview Place may have been mistreated by two of our employees. This may have impacted as many as 15 residents in the home. An internal investigation was launched at that time, and we've since found that this investigation did not follow Extendicare's policies. There were breakdowns in process, including only one of the families being notified as a result of allegations that were substantiated. In addition, the Winnipeg Regional Health Authority was not notified, and the police were not contacted. Our abuse and neglect policies outline very clearly what we are required to do and actions we are to take when allegations are made. It's completely unacceptable that this did not take place, and for that, we unreservedly apologize to the residents, their families, and to the WRHA. I'm so very sorry for the hurt that this has caused you and to our community at Oakview Place. It is certainly not reflective of our values as an organization, our mission to improve care, or our responsibility to serve the people we care for with excellence, kindness, and compassion. I've been a nurse now for more than 35 years, and caring for seniors, many of whom are vulnerable and wholly reliant on their caregivers, is truly a privilege. What we do and what we're entrusted to do is more than a job. Providing high quality and compassionate care will always be our first and most important priority. We do not take our duty to our residents lightly, and that's why these allegations are so devastating. We support the independent investigation by the Winnipeg Police and protection for persons in care. We are and will continue to cooperate fully with these investigations, and we thank them for their fast action. We also want to thank the team members at Oakview Place who stepped up and did the right thing by reporting these allegations to the Winnipeg Regional Health Authority when they saw that policies were not being followed. Our organization and I personally are extremely grateful to them. While we await the findings of the investigations underway, we've taken immediate action on the following. The home has a new experienced senior administrator, and I've been appointed as the new regional director for Manitoba. The staff involved in the allegations are not working at the home pending the results of the investigation by Winnipeg Police and Protection for Persons in Care. Staff at all of our homes in Manitoba will be retrained on our abuse and neglect policies, and staff will also be reminded about Extendicare's whistleblower program. The families or substitute decision makers of the residents who are subject to the alleged abuse have all been contacted. We have spoken to all but 3 of them, who we have contacted via alternate means. Meetings have been scheduled with the residents in the home, resident council, family advisory council, and families. Once the findings of the investigation by the Winnipeg Police and Protection for Persons in Care are available, they will be shared directly with our community of residents, families, and staff. In closing, again, I want to apologize to the residents and the families impacted by these allegations. You deserved better from us, and we will do better. Thank you.
Thank you, Sandra. I apologize. My internet is unstable at the moment here in the office, but I do have and residents, as Sandra has mentioned. Families are rightly angry, concerned, grieving, and anxious. It should go without saying that every single person in long-term care expects to be safe, comfortable, and well cared for. The information at this time is that these allegations are isolated to 2 staff members who are both on leave from the facility. Their alleged actions are not reflective of the values of safe, compassionate, and quality care that personal care home workers provide every single day. I know staff in personal care homes provide quality, excellent care for residents and come to work every day with that intention. While our focus will now be on supporting families and residents, as well as any and all of the investigations that will take place, a critical element for us will be surfacing the insights that will inform how we can better ensure that the well-established safety and accountability processes are already in place. Those are understood and followed at all times by all providers and partners without exception. We will continue to work very closely with Extendicare and their leadership over the coming days and weeks to support residents, their families, and staff that may have questions or concerns. We recognize that many families may have questions about their loved ones, and going forward at any personal care home in Winnipeg, families can certainly contact our client relations office, and we will provide their contact information after this news conference. The Protection for Persons in Care Office of Manitoba also investigates suspected resident abuse and neglect. To make a report, you can call the PPCO's confidential line at 204-788-6366, and we will also provide that information after the news conference. We, of course, will be cooperating fully with the Winnipeg Police Service in their investigation, and we will determine what additional investigations may be needed going forward. On behalf of myself and the Winnipeg Regional Health Authority, I want to commend and thank the Extendicare staff. We all know now and can deal with very serious allegations. And we want to ensure everyone in the healthcare system feels comfortable bringing forward their concerns without fear of reprisal. In closing, I also want to extend personally and professionally my deepest apology and sympathies to the residents and families involved. There aren't words really to express the shock, the anger, the grief that we share with you. We are committed to doing whatever it must be done to ensure accountability, and that we do everything we can to help prevent something like this from happening again. Thank you.
Thank you, Gina, and thank you, Sandra. And with that, we will now open it up to questions from you.
Hi, Brittany from Global News here. I'm just wondering if you can get into a little bit, we're looking at open and transparency here. What exactly are these abuse allegations? What do they range from? And how long is the time frame alleged how long is the time frame when these alleged abuses are to have taken place in?
Yes, so Brittany, these matters are under investigation by the Winnipeg Police Service, as well as the Persons for Protections and Care Office at Manitoba Health. As I said, they have our full cooperation, and at this point, beyond our communication to families, we are unable to share additional details until that investigation is complete.
When did this begin? You didn't give us a timeline on when the abuse began or the allegations of abuse began, when the investigation began in the care home, and where it's at now.
At this point, we're made aware in February of 2022 of the allegations that residents at Oakview Place may have been mistreated by 2 or more employees. Again, as Gina stated, these matters are under active investigation by Winnipeg Police and Protection for Persons in Care, and we really can't expand on anything further at this time.
Was the internal investigation launched right after the allegations were made?
Again, it's part of the active investigation, and so we're not able to divulge the specific details, as that is part of the active investigation.
You've said that you weren't notified correctly in time and that you took immediate action once you did. So I don't think that hinders an investigation for us to be told what the timeline is of when the WRHA was notified, given that this is set to have happened in February and appears that no action was taken right away.
Yeah, so the WRHA was notified on Friday, June the 10th. So as I said, very recently. And shortly after we were notified of the allegations, we took immediate actions to contact National Extendicare leadership to set out our expectations, obviously, and ensuring that the healthcare aides, first and foremost, in question were placed on leave. That was a priority, pending the outcome of an investigation. We also contacted the Winnipeg Police Service, and as I said, they have opened a criminal investigation. We've also contacted the Persons for Protections and Care Office, as well as the Licensing and Compliance Branch, and also conducted unannounced visits to ensure that residents at the facility were safe. And we also are supporting the process and the Extendicare leadership in communicating with families and residents regarding the allegations of abuse and what has happened specifically to their loved ones. And that has been our priority up until this point.
So when you're talking about mistreatment, are we talking physical abuse, sexual abuse, something else? Because mistreatment could mean a lot of things.
Yeah, so as I said, Jeff, these matters are under investigation by Winnipeg Police. At this point, beyond our communications to residents and families directly who have been impacted, we're not able to share additional details until the investigation is complete.
And Sandra, this question is for you. You touched on this. You said that once the allegations surfaced in February, policies followed. Can you talk about either what was done or not done that didn't follow the policies?
What I can tell you is that there was a breakdown in process. And for that, we unreservedly apologize. Processes were not followed, and that became very evident. We have taken steps, have put measures in place to avoid any potential risk of this continuing or happening again. The safety of our residents is the utmost importance to us.
Can I ask Gina?
Can you tell us if the
WRHA
healthcare aides had? Go ahead.
Yeah, so I'm just asking Gina, how did the WRHA become aware of this in June? Who brought this forward?
Yes, so we were made aware of the allegations by a whistleblower, a staff member at Oakview Place, as I said, on Friday, June the 10th.
And what do you have to say to families? I mean, I feel like the families that still have loved ones there will want to know a bit of the nature of what type of abuse happened. Even if these staff members aren't there now, you're saying that there might have been more than 2 staff members. So does this speak to neglect or something that they should be concerned about that could still be happening?
What I can tell you again is that it is an active investigation. So we're very limited in terms of the information that we're able to provide.
The vast majority of personal care homes provide every single day. And we will continue to work with Extendicare leadership and the new leadership on site to support residents and families in the days and weeks ahead around this investigation. Will fully cooperate. As I also said, leadership from our own team, the WRHA team, have conducted a number of unannounced visits at the site since we learned of the allegations. We have been speaking directly with residents and staff members and observing care experiences, and the results have generally been positive. And our site reviews will continue. And again, we will continue to work with the leadership at Extendicare to ensure that residents are safe.
Gina, how
Can you
are
tell us
families
the work
supposed
the
to-
healthcare aides do? What is it? Would they be alone with the residents? Give us an idea of what these 2 people would do on a daily basis.
Well, healthcare aides typically provide the day-to-day personal care of residents, and they may be responsible for several residents on a unit on a particular shift. So they are there quite, they are there right hands-on, providing personal care with residents.
Sandra, how are people who have loved ones in this home supposed to trust Extendicare right now, knowing that somebody came forward in February and the WRHA was only notified in June, and that seemingly little was done between that time frame?
Yeah, we certainly understand the reservations that people may have or the concerns that people may have, and we take full responsibility for that. What I can tell you is that we've taken measures to address those concerns and to help rebuild trust, not just with the residents and families, but with the WRHA. We have a senior administrator who has been put in place. I've been appointed as the new regional director. Families have been contacted Staff will be re-educated on both our abuse and neglect policies in all of our Manitoba homes, and they will be reminded of our whistleblower program.
You said staff didn't follow policies. Would you describe this as staff members attempting to cover this up from Extendicare in a large part?
What I will say is process was not followed, and it was clearly a lack of process or adherence to process.
What's the discipline involved, if any, for those staff members who didn't follow the process?
Well, as I mentioned, those staff are no longer in the home pending the investigation by the Winnipeg Police and Protection for Persons in Care. We are cooperating fully with those investigations, and once we receive the results, we will then share with our community at Oakview Place, the residents, the families, and the staff.
Sorry, you said 2 healthcare aides have been placed on leave. Have any additional staff been placed on leave who should have notified the WRHA and the police and other parties?
Yeah, at this time, it's 2 healthcare aides that have been put on leave. Again, there is an active investigation, and we are cooperating fully.
You said there's a new senior administrator. Was the previous one let go or fired because of this?
The previous administrator made a decision to leave the organization.
Senator, it's Shane from Global News here. I'm wondering if you can let us know when you took over in this position and when you found out about these allegations.
At this point in time, I took over effective Monday morning. And again, we were made aware in February of 2022 of the allegations about the potential abuse situation or potential mistreatment of residents at Oakview Place.
Sorry, you've known since February as well?
The organization became aware in February of 2022.
Sorry, Shane again from Global News. So, I mean, it sounds like the organization knew since February, and it took a whistleblower to let everyone know June 10th. Why is that? Why wouldn't you guys have let the WRHA know and maybe police?
You know, I'm not going to sit here in front of you and make any excuses whatsoever. We are wholeheartedly apologizing for what has happened. It is very clear that there was a breakdown in processes, and you know, we have apologized, and we will apologize again. We will do whatever we can to help rebuild trust with both the residents, their families, and additionally the WRHA.
Were those
Gina,
on
in
leave for the full
Saskatchewan,
6 months?
Extendicare.
Just a sec. Were those staff members on leave effective June or effective February?
Again, I can't get into the specifics of that, as it is part of an active investigation with the Winnipeg Police and Protection for Persons in Care.
Just to add to
I think telling us when the leave began is not hindering an investigation, or when they were suspended.
Yeah, so as soon as the WRHA was notified, June 10th, so very recently, we did communicate with Extendicare, Oakview Place, to ensure that those healthcare aides were placed on leave immediately.
So
it was June when the healthcare aides were put on leave.
It would have been shortly after we received reports of the allegations. Yes. Jeff, you're cutting out there, Jeff. I can't get your question.
Sorry, I'm just wondering if any of these post February then.
I don't know if it's just me, but the question's just breaking up for Jeff. Sandra, did you get that question?
No, sorry, I wasn't able to hear.
Jeff, could you put your question in the chat, please?
Are the healthcare aides on unpaid leave or paid leave?
Currently, the healthcare aides are on paid leave. Again, pending the investigation results.
Gina, Saskatchewan recently transferred care of all Extendicare homes to the province. Is this something that you, or what are the next steps for the WRHA regarding this company?
So at this point in time, and what we wanted to speak to the public today is really around this specific situation, these allegations at the facility at this point in time. We will continue to work with Extendicare leadership to ensure that residents are safe, that care is being provided, that processes and accountabilities and expectations are followed up on. And we will cooperate with the investigations that are upcoming from the Winnipeg Police Service and support the facility, the staff, the residents and families in the implementation of those recommendations so this does not happen again.
I'm still slightly unclear when you said there's 15 residents that were allegedly impacted by these abuse allegations, but not every single family has yet to be notified. There were still 3. Could you explain why it's taking so long to notify families of allegations that were brought forward in February?
Yes, 12 of the 13 families have been contacted. We have made several attempts to contact the remaining 3. And we continue to make attempts to contact them. It's really a balance of trying to ensure that we begin actions immediately and that the appropriate parties are informed and made aware. And that is part of our process in helping to rebuild trust.
Are those 15 residents still residents at Oakview?
At this time, that information is private and will be part of the investigation with Winnipeg Police and for protection for persons in care. Any information that I provide about residents specifically would be a breach of the personal health information.
Is the care home's license being reviewed?
At this point in time, no, it isn't being reviewed. We have shared with Manitoba Health's licensing and compliance branch and the concerns around the allegations, and we will continue to work with the leader.
You've said that you're going to be sharing the results of this investigation with the families. Will you commit to making those results public through the media as well?
And follow up to the concerns.
Brittany, just with respect to your question, again, it is an active investigation, and once we get the results, we will share it with the community at Oakview Place, the residents, the families, and the staff.
It's Scott here, and we're going to have to wrap this up in a few minutes here, but I just wanted to acknowledge that Jeff Keel is asking, are any of the abuse allegations from post-February? And I think, Sandra, you could answer that, but I believe your answer would be that at this point we can't comment. And I want to, I appreciate that the media is asking a number of questions on more details and timing. And I want to make it very clear that the police have been quite clear with us so as not to compromise an ongoing investigation, a criminal investigation, that we say as little as possible. We are communicating directly with the families, both Extendicare and the WRHA, and all the details are being shared with them. However, publicly, while it was important to us that we acknowledge this and to be transparent and to ensure that people know what we're doing, we can't risk compromising the investigation, and I hope you can appreciate that. Do we have any last questions before we wrap up? Okay, with that, I think we're going to conclude. Thanks, everybody, for joining us today.